reviewing the drug nitroglycerin. I'm going to start with the pathophysiology, as this will help explain and let us understand what the medication is doing. So nitroglycerin is a potent vasodilator, meaning that it's going to relax and widen the blood vessels. This will allow an increase in blood flow while reducing the workload on the heart and improving the oxygen supply towards the heart. So nitroglycerin is the prototype of the nitrate class. It is going to be drug of choice for management and prevention of angina, which is our chest pain. Headaches and dizziness are going to be expected when first starting nitroglycerin therapy, but we can let these patients know that over time, the headaches and dizziness will start to disappear. And like most medications, we do not want to consume alcohol. So we want to let them know to avoid alcohol consumption. In this case, it would increase the risk of hypotension if they were to consume alcohol. And then some contraindications to be aware of. So when it comes to men taking Viagra, they should not be taking nitroglycerin. They are both potent vasodilators, and essentially you're doing the same thing, which can have a life-threatening reaction on the patient. And then the systolic blood pressure, when it is below 90 or the patient's baseline systolic has decreased by 30, we want to hold the medication. So we have 6 different forms of nitroglycerin. Sublingual I will continue on the next slide. Then we have a spray, which is used on or below the tongue. It is not inhaled, and the onset of 1 to 3 minutes. Now with IVs, they are more seen in hospitals. Just know that the dosing is going to be titrated for each patient, and vitals are going to be taken frequently. Then we have the oral extended release tablets. We want to emphasize that they are not to break, crush, or chew these tablets. The onset is going to be about an hour. And then we have the transdermal patch. We want to use gloves if possible. Just keep in mind that with patients at home, they might not have gloves, so we want to emphasize that hand washing after applying. We want to let them know to rotate sites of application so that the skin does not become irritated, and to always remove the old patch before applying a new patch. Similar to the patch, we have an ointment, so we're going to use gloves if possible, always hand wash after applying, and rotate the sites. Some new information, we do not want to massage the ointment into the skin, as this can interfere with the rate of absorption, and we don't want to do that. And then, if provided, use the measured scale or paper to apply so that they are getting the right amount. So what should you know with sublingual tablets? They are taken at the first sign of chest pain with an onset of 1 to 3 minutes. And the tablet should be taken sublingual, which would mean it is going to be placed under the tongue where it's going to dissolve. And a tingling sensation is going to be normal. If a patient is concerned about that, let them know. And then they are taken in 5-minute intervals for a maximum of 3 tablets. So what this would look like, if a patient is feeling chest pain, they would take 1 tablet. In 5 minutes, if that pain continues, they would take another tablet. Wait 5 minutes. If the pain is continuing, they would take 1 last tablet for a total of 3. And these have to be spaced 5 minutes. So after that 3rd tablet, if the pain continues, they would go to the nearest hospital. So with nitrates, they can be inactivated by light, heat, moisture, and time. So we want to instruct the patient to replace these every 6 months, to store them in the original airtight container, and to keep in a dry, cool, dark environment. So what this wouldn't look like is storing it close to the body or in our bathrooms. So how do you know when to use each form? So when it comes to sudden onset chest pain, we want to use the sublingual tablet or the transmucosal spray. We could also use these for prophylaxis prior to events that we know cause chest pain. So if I were a patient and I knew that mowing the lawn was going to cause chest pain, I would take the tablet or use the spray ahead of time. Now for management of recurrent chronic chest pain, we could use the oral sustained release tablets, the transdermal paste, or the transdermal ointment. Thank you, and let me know if you have any questions.